Good morning, everyone. Today I would like to share with you the details of a recent patient intake I conducted. The patient's name is Mrs. Linda Thompson. She is a 62-year-old female who presented with several health concerns, including rheumatoid arthritis, hypertension, a recent urinary tract infection, and diabetes. During the intake, I collected the patient's basic information. Mrs. Thompson's date of birth is March the 10th, 1961. I then asked her for her height and weight. Next, we calculated her body mass index, which provided an estimate of her body fat based on her height and weight. As part of her medical history, I inquired about Mrs. Thompson's vaccination status, including the administration of measles, mumps, and rubella vaccine. She talked about being behind in her flu shots, so we made sure this was done before she left. This information helps us ensure her protection against these infectious diseases. Additionally, I discussed her sexual history to assess the risk of sexually transmitted infections. During the intake, I also documented Mrs. Thompson's blood pressure readings. As she has hypertension, monitoring her blood pressure regularly is essential to managing her condition effectively. We recorded the measurements and discussed the significance of maintaining a healthy blood pressure range. Given Mrs. Thompson's rheumatoid arthritis and recent urinary tract infection, I asked her about the prescriptions she was on and if there were any side effects experienced. This information helps us understand her previous treatments and potential preferences for future interventions. Additionally, we found she has no known allergies to any medication. Considering her rheumatoid arthritis, it is important to address her pain and inflammation. We discussed non-steroidal anti-inflammatory drugs as a potential treatment option, and I explained their mechanism of action and potential side effects. We also booked her to come back for a complete blood count and urine screening. And she was told nothing by mouth for 12 hours prior to the testing. When discussing her medications, Mrs. Thompson said she was taking her blood pressure pills once a day as recommended. She was also taking Advil for her arthritis as needed. To conclude, the patient intake with Mrs. Linda Thompson involved a thorough assessment of her medical history. Thank you for your attention, and I'm happy to address any questions you may have regarding this patient intake or any other related topic.